Yeah, well, here is the interesting crux of the debate, right? I live very close to Canada, and if I were to go 50 miles into Canada, we would cross into a healthcare system where every single person, as a function of their human right, has their right to healthcare dignified by the Canadian government. And for that right, you all pay about 11 to 13 cents on the dollar for every dollar you spend on healthcare in your entire economy. We pay 18 cents on the dollar for a system that excludes 10% of people, and for whom the other 90% who have healthcare are worried about whether or not their costs are going to land them into bankruptcy. Because, of course, in America, 67% of personal bankruptcies are a function of healthcare costs. And that's because our corporatized healthcare system takes money off the top to deliver major bonuses for CEOs. So in my state, 70% of health insured people have their health insurance through a company that's a nonprofit called Blue Choice, excuse me, Blue Cross, sorry, Blue Cross Blue Shield, and Blue Cross, their CEO made 19 million bucks last year. And then the other problem with our system, right, as a function of the system, is that we think about our healthcare choices as customers, right? And that's an odd way to be thinking about it in Canada. But in the U.S., we think about ourselves as customers. But here's the problem, right? In the United States, imagine you have health insurers on one side and you have hospitals and doctors on the other side, and then you have the patient. And the patient pays a certain amount of money every couple of weeks, and their employer pays money to the insurance. And they think that the operative term in insurance is sure. They think that the insurance is going to be sure. It's going to be there for them, right? And then what happens is they get sick. So then they go see the doctor, and the doctor then charges their insurance. All right. So here's the interesting thing. We use the analogy of a customer, but the reason, right, in this system, you're simply the reason that money changed hands between the folks on this side, the insurance system, and the folks on this side, the hospital system. In that analogy, you're kind of a lot more like a product, right? Like if I go shopping, I pay money to the cashier, right, for whatever it is I bought. That thing I bought was the reason a financial transaction happened. And so in our system, we're taught to think of ourselves as customers, but really we're the product. And because we're the product, right, the kind of haggling that happens between these folks trying to increase their market dominance, it drives up the cost of healthcare even more. So people tell us, yes, oh, it's going to be so much more expensive. But the fact is that because we'd be addressing the disincentives on any side to reduce costs by creating one government health insurer, right, we would be able to reduce the overall cost of healthcare and include everybody in the country. And I know that seems like it's too good to be true, but here's the thing, that it can exist. And I know that it can exist because I live 50 miles south of you, and I spend a lot of time thinking about healthcare.